Hello there. It's a delight to have you join us for Health Matters on Channels Television. I am Mary Alale Yusuf. Newborns are said to have jaundice when their skin has a yellow hue. The eyes may also be yellow. Jaundice is the most common condition in newborns that needs medical attention. It is caused by the buildup of a substance called bilirubin in the blood. Almost every newborn worldwide develops jaundice. Serious cases are more common in East Asians and American Indians, less common in Africans, and seem to occur more in populations at higher altitudes and in boys. Dr. Jejelola Ladele will be discussing neonatal jaundice with me on the show. She's the Senior Registrar of Paediatrics at the Lagos University Teaching Hospital, Idi-Araba. You're welcome to the show.
Thank you very much.
Now, what is this bilirubin and why is it being released into the blood?
Okay, bilirubin is it's a pigment and it's the end product of red cell breakdown. It's normal in the system, everybody, whether adults or babies, to have after a certain particular amount of time to have your red blood cells being broken down. So it's actually the end product of that process.
And it's always released into the blood?
Yes, it is always released.
That's why, you know, the statistics say it's like almost every infant that gets this jaundice?
Yes.
But if it's so common and it's like, you know, almost every baby, is it normal then?
It actually reflects, most of the time it actually reflects a normal physiologic process. It's just that in some rare cases or in some cases you have a pathologic process also being part of the whole system. So it's like an interplay between those two factors now causing an increase in the level of bilirubin. But it's normal, it's almost certain. Some say about 80% of preterm babies and almost about 60% of full-term babies will develop jaundice at birth, as in the newborn period.
Okay, so at what point does one know this is no longer normal, it's now pathologic or it's now a disease?
Actually, it's the term physiologic jaundice is almost used, it's a diagnosis of exclusion. That means you have excluded every other thing that you think may be causing the jaundice. It's usually, now physiologic jaundice, there are some pointers that may make you think that this child has the normal jaundice. Depends on, okay, the time that it starts, the level it gets to and all that. But in most cases, it's usually not clear-cut. So most of the time when you have jaundice, you really have to monitor that baby. And then in the process of monitoring, you discover, oh, you get to know, oh, this is a mix of the two. This is majorly pathologic or this is majorly physiologic. But you can't actually pinpoint and say that, oh, this fraction is caused by physiologic, this is caused by pathologic. No.
Okay, so how soon after birth does one get to see the yellowing of the skin?
Now, you can have jaundice even right when the baby is still in utero, depending on the cause of the jaundice. The normal physiologic jaundice that people say would usually occur start about the 2nd to the 3rd day of life, will peak about the 5th and 6th day of life, and then clear. Meanwhile, however, the pathologic jaundice can be seen even in utero right from the 1st day. Even the 5th day, the 7th day, or even 2 weeks after life, it can occur at any time.
Okay, so it's more persistent, it's more long-lasting?
Yeah, and the time it comes up may actually be different.
Apart from yellow skin, are there any other symptoms that come up? Okay,
the yellow skin is the commonest symptom that you would find. In fact, you actually have to tell mothers when they are going on with their babies, oh, you need to look into the eyes, you need to look at the skin. By the time you start having other symptoms, then you may actually be getting to dangerous times. Or if a child presents with fever, the child presents with abnormal cry, there's an abnormal body movement, there's a change, it's not sucking properly, you need or not feeding properly, then those are pointers that you may actually be having serious jaundice.
What are the risk factors for, you know, a child actually having the dangerous type of jaundice?
Okay, there are several risk factors, some of which you mentioned. earlier on at the beginning.
That's prematurity.
Yeah, prematurity. You have a family history of severe jaundice in a previous sibling, or jaundice that necessitated treatment either with phototherapy or with exchange blood transfusions, or you have a family history of a genetic problem. You have jaundice can be caused by genetic mutation or genetic problems, or hemolytic anemias that are in a family. Some descent, people from East Asia and some parts of America, as I said.
That's the higher.
Yeah.
They get more of it.
Yes, then you have the altitude. But in our own environment, the commonest cause of jaundice in the newborn is said to be GCSPD deficient, which is like an enzyme defect that commonly is an X-linked defect. So you commonly see it in boys, but it can also occur in girls.
Okay. So now, you say that jaundice is common. It happens with most babies.
Yeah.
Why then why are they discharged so early? Isn't it better for them to stay behind in the hospital and just get it over with?
Actually, there are so many factors. You wouldn't keep an otherwise healthy baby in the hospital just because you're suspecting that the child will develop jaundice. Secondly, majority of the jaundice you have would not necessitate treatment. There's a certain level. So ideally, what we usually do is once you discharge a child healthy, no problems, you give the mother's instruction. Some of them you're told, okay, bring the child in 2 days. Let's see. So depending on what works for that system or the level of education of the mother and all of that. Some you are told to present earlier. Some you refer them to centers around them, health centers that they could go for checkups. Some, for babies that develop jaundice while they're still in the hospital, but the jaundice are levels that do not require treatment, you discharge those babies to what we call jaundice clinics, where they are followed up. So those that require treatment will be readmitted into the system. Those that do not will just be followed up and discharged thereafter.
If a mother neglects the signs and doesn't bring the child to the hospital when the child has severe jaundice, or I wouldn't want to call it severe jaundice, has the bad type of jaundice, if the parents neglect to bring the child to the hospital, what's likely to happen to that child?
Okay. That is usually what we do not want. The worst case scenario, you could have a child that ends up with what we call encephalopathy, bilirubin encephalopathy, where the brain is damaged. And some babies may actually die. Some babies that survive may not recover from that encephalopathy. So they are...
Does it affect movement,
yeah,
thoughts?
It does. It actually... what usually happens is the kind of encephalopathy it causes is something that affects the motor system, and so the brain itself is not affected. The child can think, it just looks like the child is trapped in a body that cannot function. So it's actually worse off than when the cognitive functions are affected. No, the cognitive functions are usually normal. So the child can think, the child can see, knows what is going on,
but can't
respond. Yes, can't really respond.
Can't even respond.
No, some of them do not end up, when this occurs, usually the visual and auditory, that's the speaking and hearing components are usually affected in pathologic jaundice. So some of them may not be able to speak properly, may not. Some of them may not hear properly, and
then can't move.
And then really can't coordinate movements. Some of them may end up with cerebral palsy. They may not be able to function properly. So they are saying but they are not responding. So it's like being trapped in a body, which is worse off actually. And you know what's going on, but you can't respond.
Is there a way of preventing a child ever having jaundice, whether bad or good?
Oh, really, no. Because like I said earlier on, the normal jaundice, or most of the jaundice is physiologic, and which is a normal process. It's like a reflection.
What's happening here?
Yeah, what happens?
When they get yellow. Why? Okay. Because you don't get yellow, I don't get yellow, okay. and blood is breaking down. Yeah. So what's going on? What
usually happens is that in the newborn period, their red blood cell mass, that's the total volume of their red cells, are quite much. They're way higher than in adults. And so once they're out, aside the fact that this mass is higher, the lifespan of the red blood cells in newborns is also shorter.
Okay.
So they're going to break. There's an increase
faster
in the breakdown. And then secondly, what also happens is the liver is not yet matured enough. So the binding proteins, we have what we call the ligandins. Those are the binding proteins to the bilirubin, are not fully developed. You don't have, they're not increased yet. And secondly, you also have the bilirubin we are talking about here that causes the bad one is the unconjugated bilirubin. There's a particular enzyme that conjugates that bilirubin and makes it so that it can be excreted from the body.
Harmlessly.
Now that enzyme is also in decreased amount in the newborn. So you have an interplay between two factors. The fact that red cells are being broken down faster, and then the newborn liver is not able to excrete the bilirubin as fast as the red blood cells.
And there's no, say, injection or drop that develops the liver of the baby to make it stronger, better able to do this job?
No, actually. In some cases, you may need to give a drug. Those are we have some genetic conditions where, like the Gilbert syndrome, where you can help. What is happening there is that the enzyme that needs to conjugate is not being formed properly. So you give a drug to help produce that. But that is in those cases. It's not for
every
everyone.
case.
Yeah, it's not in every case. The best thing to do for jaundice is to identify it early and then get it treated if need be early. That is the best way of preventing serious or severe jaundice in the newborn.
So mothers should just be on the lookout, and then the people in the hospital should be on the lookout.
Not only mothers, even health workers. And then there are some factors in the mothers that needs to be checked, like before she even puts to bed. You need to know the mother's resource status. You need to know her blood group. There are some factors that will give you an idea. It's also said that infants of diabetic mothers too have a higher risk of developing severe jaundice. So these are things that if you have those factors already in play, there's already a family history of hemolytic anemia, there's a family history of severe jaundice or something in a previous newborn. Those are risk factors that needs to be put in place when you're taking care of this newborn, so such that you can identify on time if this child is going to develop severe jaundice or not.